So it's been about how long since you've been home from Russia?
3-4 weeks.
So how are you feeling?
Feel fine.
Are you all better from
All that stuff is gone.
spinal tap,
Fine.
trauma?
Fine.
Okay. And you started a week ago back to therapy, correct?
Correct.
So what are some of the things you're doing in therapy?
Strengthening, exercises, all that same stuff that I was really pretty much doing before I left.
Okay. So you're doing all kinds of therapy now. I went back to the Rehab Institute. You're doing occupational therapy and physical therapy, and you started about a week ago. And what are some of the things that they are doing that are different now in your therapy?
They're not necessarily doing things differently, they're just doing things progressively. So things that I wouldn't have been able to do before, I'm now able to try them and able to do it to some extent. So they just, every time I go there, they offer new ideas and suggestions on how I can
Well,
better.
show us how you can move your arm around now. Like, you know, you can take your arm, you can move it above your head, right? Now,
Really stop.
okay, so just show us how you can move your arm now. Okay, you can move it around. You can lift it up to above your head. Okay. All right. Move it out. Okay. So right now, you know, right now, I mean, you haven't really felt anything new or changed, you know. And the things that the doctors told you about your arm that could eventually, he said, how many weeks probably before you would maybe even see anything after doing your therapy?
There's 4 to 6 weeks for the stem cells to even become noticed, and 3 to 4 months for you to really tell any difference in the way I move.
Okay. What about your leg? I mean, we just want to see how your leg is doing right now, because, you know, as you're doing your therapy and the weeks go by, you know, we'll come back and talk to you and just see how things are improving. So, like your leg, I mean, how you're walking, I mean, your leg's in a pretty good place right now. I mean, okay. Right. But didn't you go to therapy the other day and Joanne did some tests on you and she said that your arm strength has improved?
That's right. My grip strength is 70 pounds.
Compared to what when you left there?
When I first started with therapy, it was 25 pounds.
And so you're 75 in your left hand now, right?
Yeah.
Grip strength. Okay. But that's
145 on my right.
okay. All right, but things are you're recovered from the spinal tap procedure. You're feeling better, you know, in that essence. So you just got started. You've been doing some biking too, correct?
Yeah,
Biking. Gym a few times.
Going to the gym a few times. I'm going to start going. Tomorrow I'll start back on the treadmill and the elliptical machine, as well as do the home exercise programs that Joanna and Teresa have prescribed.
Okay. All right, but you're feeling much better.
Yeah, I'm feeling better.
Okay. All right. So we'll check back in a few weeks, in a couple of weeks or so, see how things are going.
All right. See you then.